Okay, so we're going to jump into digital design. And digital design for today is all about guided surgery. So every course that we do, we're going to hit acquisition, design, and output based on the procedure that we're talking about, whether it's a denture, a night guard, a shell temp, a wax up, a surgical guide. We have to acquire the data in the right way, we have to design the data in the right way, and we have to output it in the right way. So today is all about guided surgery, because you guys are all going to go home and you're going to start doing these things in your practice, or your team members are. So what is guided surgery? It aims for accuracy and predictability. So we want the implant. We all know that there's a perfect position for an implant. We all know what that should be, where the screw hole axis should be, where the depth should be in relationship to a proper emergence, whether that's a single unit or whether that's a full arch hybrid. All these things factor into the long-term outcome of that restoration. So today's not so much about how deep should my implant be necessarily, or what implant should be, or the surgical considerations, but it's how do we design something that'll get us to that. So we still have to have the proper surgical training and restorative training, but this is how to execute that predictably every time. It aims for lower swelling and edema with more minimal types of surgeries. And so if we can utilize guided surgery to be more laparoscopic in nature, that can be a benefit. So I use that term with a patient all the time, and if they're saying, why would I want guided surgery? Well, it's accurate, it's predictable, it's maybe less invasive. So, flapless surgery. If we have a lot of keratinized tissue, when we're not worried about losing a little bit of that, and the situation's appropriate, sometimes we can do that situation flapless. That's really kind of the easiest way to go. If you can snap a guide over an arch and just drill right through the guide, through the tissue, and put a healing abutment on, really minimally invasive. And so less flap means less trauma, less swelling, less edema. The same with the physicians in surgery, they're thinking laparoscopic, and patients know that terminology. So when you can speak to them and utilize, hey, less invasive because of this. Oh, cool, I want that. So that's a potential with guided surgery. So less discomfort, faster healing, less pain if we can control some of those areas. And then it aims for prosthetically driven dentistry. So we're planning depth of placement, screw hole access, thinking crown and bridge, or thinking restorative in mind.